Hi, my name is Georgie. It's nice to meet you. I'm going to be conducting your medical examination today. How are you feeling? That's good. So, I have all your medical information right here. And I'm going to be writing some notes down as we go, and then I'm going to finalize your notes, and we can have a look at what's going to be next, okay? So, all I really need from you is I just need to know your name and your date of birth. Okay, good. And your date of birth, perfect. So that is all normal, good and correct. Okay, so we're gonna get stuck in first. I'm just going to pop on some gloves. You don't need to be nervous about anything. Everything's going to be very simple. There's no needles. Okay, and if you do feel uncomfortable at any time, you'll let me know, okay? Alright. Okay. So we're gonna start off by having a look at your facial features. Okay. So if you don't mind, I'm going to come a little bit closer, and I'm just going to just feel around your face, just the muscle area, okay? Okay, so just looking at your muscles, okay, and your jaw structure, okay. That is very good, very good. Okay, and if you can just open up your mouth for me, so I'm gonna listen to any clicking that might be around here. Okay, so if you can just open up your mouth for me. Okay, and close. Okay, and just open them for me again. Okay, so I can hear a little bit of clicking. Do you get any pain when you do that? Do you have any pain chewing? You don't? Okay. Okay, and just on the other side now, so if you can please just open up your mouth. Okay, and close for me. Okay. Perfect. And just one more. Okay, so there's just a little bit of clicking, but that's okay. You don't feel any pain, so I'm not too worried about it, but I will note it down in just a moment. Now I'm just feeling around your cheeks, okay? Okay, and there's no pain there. Good. Alright. Okay, and what about under here? Okay, alright. Nothing? Okay, good. So, you've got nice pink skin as well. So, I don't see anything that looks too worrying, any dermatitis or eczema or anything out of the ordinary there. Okay, good. So, I'm just gonna pop that in my notebook. So we just want to note down that there is some clicking inside of the right and left. Okay, but it doesn't give you any pain, which is great. And cheeks are looking nice, no undertone. Skin is not gray or washed out or ghostly looking. Okay. Alright, so still keeping on the face, okay? So I'm just going to rub on your temples here. And is there any pain there? Nope. Okay. What if I just press, like tap, 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 tap? Okay. And nothing? Okay. And just again. Tap, 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 tap. Okay. So there's nothing there, which is great. Now I'm just going to your forehead and I'm just going to apply some pressure just around your eyebrows, okay? And if you can please let me know if there's any pain, okay? So I'm gonna press here. Good, okay. You're doing good. And we're just going to press, 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 press. Great. That is wonderful. Okay. Perfect. Okay. So what I'm gonna get you to do is I'm going to try and push your face away, and I want you to resist, okay? So I'm just gonna put my hand against your cheek here, so keep straight, and as I push, resist for me, okay? Okay, so just resisting. Okay, alright, that is good. You're pretty strong. And again, just okay, good, okay. So just on the other side now. So I'm just going to apply some pressure onto your cheek here. Okay. Okay, good. And just again for me, applying that same pressure on your cheek. Okay, right, that's very good. Now I want you to do a couple of facial movements for me, okay? So if I can get you just to smile for me, so nice big smile, and I want to just have a look at your teeth just as you're smiling. Okay, they're nice and pearly white, just nice. Okay, great. And I want you to frown now, so I want your brows to furrow. Okay, so real annoyed. Okay, good. And if I press here, that feels okay? Okay, really good. Now I want you to look very sad now. Just frown. Okay, just sad. Okay, I'm just feeling around here, which is good. Okay, perfect. And if you can raise your eyebrows for me, okay, as high as possible. Okay, good. And if you can just close your eyes for me. Okay, and as you're closing them, I'm gonna do the same as your cheek and the resistance. I'm gonna try and open them, but if you can please just keep them tight. Yeah, okay. So I'm just gonna try with both of them, okay? So just close your eyes for me. Okay, and again. Good, perfect. Thank you very much. So, yes, so you only need about a check every. It really depends on the person, but I would say once a year get a check just to make sure that everything's normal. Because there may be some blood tests that we might do on you, just to rule out any possibilities. So it's looking in your eyes and seeing if you've got any iron in there, that sort of thing. If it's pale, you might have anemia, just an iron deficiency. So it really just depends how the examination goes. But I would say once a year if you want to keep yourself in check. Okay. going to have a look inside of your mouth. So if you can please open up your mouth for me. And I'm gonna come a little bit closer. So I'm very sorry for my sandwich breath. So if I can get you just to open up your mouth, and I'm just gonna use this here, and I'm just gonna place it on your tongue so I can have a look inside your mouth. And I also have one of these, so it lets me have a look right at the back of your teeth. I'm not a dentist, but I know when I can see, some plaque, or you definitely, Okay, so if you just open up your mouth, okay, good, and open wide. All right, so I'm having a look, and they're looking pretty nice. Okay, do you consume a lot of sugar, or sometimes? Okay, and savory foods, right? That's okay. We all do that. So just gonna have a look right in there, and if you can go okay, just a little bit longer and just a little bit wider for me. Okay, great. And I'm just having a look. Right, that looks good, and you can see a little bit of plaque on there. So when was the last time that you went to the dentist? Okay, so you might want to see the dentist every 6 months. So if it's been a couple of years, I'd recommend that you go there very soon. You only have one pair of teeth, so it's best to get them checked out. Okay, good. Thank you. Everything is looking great, and you don't have... I'm just going to check, sorry. So I'm just going to get you just to open up your mouth again, and I'm going to flash a light. I just want to have a look at your tonsils. Okay, so... Alright. Okay, just open up just a little bit more wider. Okay, good. Okay, and just again, if you can please go, okay, great. Okay, and I'm sorry, I'm just having a quick look at your tongue too. Right, tongue doesn't have any cracks in it, so that rules out a couple of things, if there was anything. Okay, great, perfect, thank you. So your mouth is looking good. I can't see any huge cavities. Your tongue is looking nice and pink, and no cracks. I don't see any possible damage to the mouth or around the cheek areas, no blood blisters. Okay, good, perfect, thank you. So next, I'm going to be looking at your eyes, okay? So I have a number of different colors here. So I'm going to take a couple out, and I'm going to ask you to close one eye for me, and you're just going to tell me which colors that you see for each one. Let's have a look here. I think that will be sufficient. Okay, so if you can please just close one of your eyes for me. Thank you. And we'll start off with this color first. So just the tip. Okay, great. And this one here. Perfect. And what about this one here? Good. This one. Wonderful. This one. Perfect. And this one right here. So if you would like to turn to the other side now. Perfect. I'm just going to do exactly the same thing, okay? So you can tell me which color that is. Perfect. And what about this one? Great. And this one here, it's green, that is correct. This one here, orange. This one here, perfect. And this one here, great, that is perfect. 6 out of 6 on that one. Now, I'm gonna come a little bit closer to your eyes. Okay, so just come a little closer, closer, closer. And I'm just gonna have a look around your eye. There's gonna be some lights, and me touching around the areas and coming a little bit closer. So I hope that you don't mind. If it gets too bright, please let me know, okay? So if you can look just straight ahead for me. And I'm just having a look at your eyes. Okay, I'm just seeing how they move when you're looking around. Okay, and just on the other side, having a look around. Okay, that's great. Okay, so I'm just gonna come a little bit closer, and I'm just going to look inside. So if you can just look up for me. Okay, so when I'm looking up, I'm just having a look to see how red and pink that we are. So you're nice in the pink, which is good. It could be a little bit darker. Do you eat steaks or iron foods like spinach and broccoli? Any liver? Liver is really good. Not many people would consume liver, but it's actually very iron rich. I do recommend it if you do need to have more iron in your food. You can just season it and then fry it. The texture is very strange, but you will get used to it. Okay, so that's just something if we do find out that you've got a bit of anemia or something low iron, okay? So I'm just going to have a look inside that eye again. And I'm going to use my light this time, okay? And I'm just gonna come in, so if you can keep looking straight ahead for me. Okay, and the light's just coming in now, okay? Great. Keep looking. So your pupils are dilating nicely. Okay. Okay. Great. And just coming over to the other side. So if you can just look in the distance again for me. And I'm just going to come over with the light. So. Great. Okay. Good. It's looking perfect. Okay. So that one is reacting as well. And I'm just going to pull your eyelid down. And I want you to have a look up for me again. And I'm just going to shine the light. Okay, perfect. Now, if you just look straight ahead for me, keeping your head straight, I'm going to come in and it's a swinging sensation, okay? So, if you just keep looking straight, swing. Okay, okay, okay. Okay, that is looking really good. And just on this side. Okay, and we're looking good here. Okay. Good. Okay. Perfect. Okay. So I'm going to go individually with your eye again, okay? And I'm going to get you to look up, down, sideways, okay? And if you can keep your head straight, I'm going to have a look around, okay? Okay, so if you can just look up for me. Okay, and I'm just having a look down, okay? Great, okay. And if you can just look down for me. Okay, I'm just going to lift this up here to have a look, see, okay? That's looking great. Okay. And if you can look in any direction, the left or the right. Okay. This is looking good. Okay, I see no irritation in the eyes either, which is great. And just to the other side for me. Great. Okay, good. And I'm just going to get you just to blink a couple of times. Okay. Good. And I'm just coming to the other side now. So if you can look just straight ahead for me. Okay. And just having a look. And if you can just look down for me this time. And I'm just going to lift that eyelid up. Okay. Right. Okay. Perfect. And if you can just look up for me. Okay. Alright. Okay, good. Perfect. The light's okay for you. Okay, good. And if you can look to any side, left or right. Okay. Right. Okay. Perfect. And just to the other side. Okay. Great. Alright. That looks good. Thank you. And just blink a couple of times. Okay, I'm just going to write some notes. So, I can't see any signs of tiredness, any signs that anything could be wrong with your eyes. Your pupil dilation is really good. And again, there's nothing that looks damaging. There's no scratches or anything. There's no red vessels that are popping out. So, do you get enough sleep? 8 hours. Okay, so I'm just going to write 8 hours down sleep, which is a sufficient amount. That is plenty of sleep to get. Okay, perfect. Thank you. Okay, so I just have a couple of things left with the light, and we're going to test you with a Snellen chart as well, okay? So, just with the light, if you can please just follow it, okay? So, keeping your head still and just following the light, okay? So, it is coming in. Okay. So, we're just going to keep it very slow. Wonderful. And up and down. Okay. And up here and down here. Okay, you're doing good. And just with the other hand now, we're gonna go sideways and down, and then over here. Perfect. And up and down. Okay, good. And I'm gonna come a little bit closer with the light. So just keep looking straight ahead for me, okay? So we're just going to come in. So if you can just keep looking at the back, and when I tell you to, I just want you to have a look at the light, okay? So keep looking at the back, and now look at the light. Okay, if you can just look back for me. Okay, and have a look at the light. Perfect. And just on the other side now, I just want you to have a look at the back. Okay. Alright, now have a look at the light. Okay, good. And just back again for me. And have a look at the light. Perfect. And I'm just going to come in now, and if you can just follow the light for me. Okay, and just keep looking. I'm just going to have another quick look inside those eyes. Perfect. Okay. Thank you very much. That's all we have for the light. Around your eyes anyway. And we're just going to finish with your eyes with the Schnellen chart. So I have the Snellen chart here, and what I want you to do is I want you to start by reading this line here for me. Okay, good. And if you can just cover one eye for me and read this line down here. So this one here. Perfect. And just to the other eye now, I want you to read this bottom line if you can. Okay, good. That's great. Thank you. Okay, and now I just want you to read just from the top to the bottom now. Okay, just as best as you can. It's fine. Okay, perfect. Right. Sorry, if you can just start this line again for me. Okay, so P, E, C, F, D. Okay, good. And keep going for me. Perfect. Right, okay. So this one down here for me, and if you can say it backwards for me, that would be great. Perfect, thank you. And I just want to ask you what this one says again, okay? And just this one right here. Okay, good. Thank you. So your eyes, we're looking at 20/20 vision. Okay, looking absolutely spectacular, especially with the light. We can see that nice color inside there. Your iris and your pupil dilation was fantastic. So very good. Okay, perfect. So I'm just gonna quickly have a look at your nose now, okay? Do you find that you have any issues with it at all? So smelling, finding it hard to breathe at nighttime? Okay, that's fine. So I'm just going to come a bit closer, and I'm just going to have a feel around the structure. Now, have you had any surgeries or anything like that? A little bit better. Just coming closer again just to have a look. Okay. And I'm just going to close one side of your nostril, and if you can breathe in for me. Okay. So if you just breathe in for me. Perfect. And again for me. Good. And just on the other side. Okay. So there's a bit of a slight difference there. It could just mean that you have a deviated septum. But if you're saying that everything is fine and you can breathe properly, you're not having any snoring or disruption of the sleep. I know that you said 8 hours of sleep. Do you get up to go to the toilet at all? every once in a while. Okay, so next I have 2 bottles here, okay? And you're okay to keep your eyes open because they are a clear liquid. And I'm going to open each one for you. And if you can please just tell me what you smell, okay? So we'll start with this one. Okay. And I want you just to have a smell of it. Okay. So 1 sniff. If you hold your nose here, take a deep, okay? Just take a sniff. And just on the other side. Perfect. Okay. And what do you smell? Coffee? Okay. That is correct. It is coffee. Now there is this one here. Okay. And I want you just to smell that one. Okay. Okay. I'll let you have another sniff of it. Okay. It's spearmint. Thank you very much. That can be a little bit tricky because sometimes it does smell like the normal mint, but then you also have the trick with it smelling like spearmint. So your sense of smell seems to be very good, and your nose structure is very nice as well. So I'm just going to have a look just up your nose, okay? And I'm just going to use this small device. It's got a little light on it, okay? And I'm just going to get you to tilt your head up for me, and I'm just going to have a look inside your nose, okay? Okay, so I'm just going to lift up here. Okay, good. Okay. Okay, and that is looking very good. Okay, good. That is looking great. Thank you. Now, I just want to have a look inside your ears now. Okay, so what I'm going to do, I'm going to just feel around the outside and then going to have a look on the inside with the otoscope that I just used to look around your nose, okay? Perfect. So, I'm just going to come around, okay, and feel each one individually, and I'm just going to have a look as well. So, okay, so this one looks okay. There's no lumps or bumps or any lesions that I can see, okay? Perfect. Okay, and if I pull here, it doesn't hurt. Okay, good. And I'm just going to have a look on this side, okay? Having a look right here, just going tappity tap just on there, okay? Tappity 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 tap, okay. And there's no lesions or any signs of blood or cuts or just any lumps or bumps in that section. Okay. And how do you think that you can hear? Pretty well? Okay. Alright, so I'm going to have a look with my otoscope, okay? So I'm just going to place this cap on here, okay? And this it just lets me have just a deeper look inside of your eye, okay? So I'm just going to, okay, so I'm just having a look inside your ears. Okay, and there doesn't seem to be any too much wax in there. You can see your tympanic membrane. Your eardrum looks pretty clear. I don't see any damage. Okay. Do you use cotton tips at all? Sometimes? Okay. That's fine as long as you aren't going in deep, because we still need some earwax to protect it. It just protects our ears, okay? So I'm just going to go back in again just to have a nice look inside, okay? Okay. Perfect. Thank you very much. And I'm just going to come over to the other side now, okay? So I'm just going to place and have a look inside your eardrum, and it is looking fine to me. Bit more wax on here, but it's nothing to be worried about. Just okay, it's looking good. Okay, perfect. And the tympanic membrane in the eardrum looks pretty nice. Okay. Okay. Perfect. Thank you very much. So we'll just pop this into the bin. And I'm just going to whisper a couple of things in your ear. Okay, so I'll just whisper 3 things in each ear, and if you can repeat them after me, that would be great. Okay, so we'll go on this side first. So, pineapple, plum, and orange. Okay, good, you got those correct. And just on the other side, okay, so we've got blueberry, apple, and gooseberry. Perfect, thank you. So I'm just going to write that down. Ears and nose look superb, no issues at all. Okay, so this is gonna do a couple of different things now, so I'm gonna take too much of your time. So I just want you to tell me if this feels like a brush or this feels a little bit like a spike, okay? So it's not gonna hurt. So I just want you to close your eyes. Okay, perfect. So I'm just gonna go pop. Okay. And what do you think that was? Okay. And what about this here? Okay, and again, just in different areas. That one, a bit pointier. Okay. And what about here? Okay. And here. Okay, pointy. This one here. Perfect. And here. Okay, good. Thank you. Now I'm just going to have a look at your neck. So I'm just going to feel around the muscles and your lymph nodes, okay? Great. And you haven't felt any pressure or anything like that? Okay, good. Right. So your glands aren't up too much. That's fine. Okay, they feel okay. That's great. Have you been sick recently or a couple of weeks ago? Okay, it could just be that. Okay, and I'm just gonna feel this part here, okay? So I'm just going to a little bit of pressure on there. And what I want you to do now is I just have some water here, and I just want you to take a mouthful, and when I ask you to gulp, if you can do that for me, that would be great. Okay, so I'll just leave this here for you. And I'm just going to hold your throat here, and if you can just gulp for me. Perfect, thank you. So that worked perfectly. Great. So what I want you to do now is I'm just going to firmly push on your shoulders, okay? And I'm going to try and push them down, and I want you to try and resist by pushing up for me. Okay, so you ready? Okay, so I'm going to push, put a bit of force on there. Okay, good, and just again for me. Okay, you're very strong. Okay, and I just want to have a look at your hands now. So if I can just have a look at your hands, okay? Okay, so we've got some color here, and I'm just going to squeeze your fingertips, okay? Just making sure that the blood comes back. That comes quickly, okay? That's good. And they're not looking pale, so that's great as well. Okay, perfect. And if you can just do that with your hands very fast. Okay. Perfect. Great. And I want you to go like that next, okay? Just with these 3 fingers, okay? Perfect. Thank you very much. Okay, good. Right, so next I'm going to listen to your heart. Okay, so I'm just going to come a bit closer. Okay, I'm just going to have a little listen to your heart. Okay. Okay, so just take in some nice deep breaths for me. So okay, and again. Perfect. And just again for me, I'm just going to put the stethoscope in just different areas of your chest here. Okay, good. And right here. Okay, so it's got a bit of a boom, 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 boom. So that is looking pretty nice. Okay. And I'm just going to come around to the back, okay, just very quickly. And I'm just going to test your lungs, okay? So what I want to do is I just want to make sure that your breathing is perfect. There's no obstruction there. So if I can just get you just to take a nice deep breath for me. Okay. Sorry, it is a little bit cold. I'll just try and warm it up with my breath. Okay. And if you can just take some nice deep breaths in for me. So nice deep in. Okay. And back out. Right, alright, okay. And just again for me, nice deep breaths for me. Perfect. Wonderful. Okay. And just one more for me. Just nice deep breath for me. Okay. Perfect. Thank you very much. Well, your heartbeat is very strong. I don't hear anything that sounds like you might need an ECG, okay? So I hear no heart murmurs or anything like that. You haven't been told you have any heart murmurs or... Okay, good. And do you have any family that has that in the past? No? Okay, good. Just as long as you're having a healthy diet as well. You just want to make sure that as you get older, your body sort of decreases and comes a little bit over. So we're just going to make sure that we eat nice and nutritious foods so that we can stay a little bit stronger whilst we go a little bit downhill, you know? Okay, so the last thing that I'm going to do is I'm going to just check your blood pressure. Okay, so if you can please just layer your arm out for me. Perfect. Okay, and I'm just going to put that just around your arm here. Okay. Okay, good. So, excuse me, a little popper just fell off there. That's better. Let's start. Okay. Sorry, it just gets a little bit tied up to this point, but I won't do it for much longer. If you can just wait a moment. Okay. Perfect, thank you. Just gonna take this off now. Perfect. Thank you very much. Okay, your blood pressure is perfect as well for your age. So that's it. That's all of your exam done now. So I'm just gonna write a couple of notes. Okay. And we'll take this to your primary doctor, so they'll get an email. What I would like is your eyes were pink, but I thought they would be a little bit more pinker, so we might do a blood test on you and have that organized, just to make sure that your iron levels are good. And I do just want to check your vitamin D levels because you are pale and we don't get much sun here. Okay. Perfect. That's okay. The nurses there will take perfectly good care of you, I can assure you. I'm a doctor, but I'm terrified of getting needles, so it's just, I mean, I've got a tattoo, but that didn't hurt at all. But when I get a blood test, just I faint. So it's just something about getting blood tests that I just don't like. I can do it on other people, but not me. Definitely not me. Okay. So I've marked that everything looks perfectly normal. We just need a couple of blood tests, okay? And I might get a urine sample as well, just to make sure that everything's okay down in that area. Okay. Perfect. So I will fax this off to your doctor at the end of the day, and I'll just give this sheet to you. If you can give this sheet just to the receptionist, okay? Perfect. Okay. Well, thank you so much for coming. I hope that I can see you next year as well, okay?